So when we talk about MAT, we mean medication-assisted therapy. What that means is we're going to use medication to help somebody with their withdrawal symptoms and cravings. Now, what you have to understand about cravings what drives relapse. Just like we have cravings for food, we have cravings for the drugs that we're addicted to. But the kicker is the cravings we have for the drugs that we're addicted to are about 10 times stronger than our cravings are for food when we're hungry and water when we're thirsty. So it can be very, very difficult to overcome cravings, as you all know. Medications, there's 3. Naltrexone, sold under the trade name of Vivitrol, buprenorphine, most people recognize as Suboxone, and methadone. 2 of those 3 medications, buprenorphine and methadone, not only quell cravings, but they prevent withdrawal syndrome. So used to, we'd have people come in, they were withdrawing, they were dope sick, about the worst feeling you can ever have. You're sweating, your bones are hurting, your muscles are hurting, you can't sleep, you can't think. I mean, just a miserable existence, have trouble with your bowel, your bladders, and we had nothing to give them really other than symptomatic treatment. But now we have a medication with just in a couple of hours, we can get you feeling better really, really quickly. Because who wants to sign up for the other? Once we get you feeling better, now we can start to help you get your feet underneath you going forward. Over the long term, medications help with cravings, all 3, naltrexone, buprenorphine, and methadone. So 2 of those medications, the last 2 that I mentioned, methadone and buprenorphine, have a 70% mortality benefit. What does that mean? That means that 70% of the people who would have otherwise died don't. And last but not least, this is the thing I always get. Oh, you're switching one drug for another. If that was really the case, we would never lose a patient. We have a hard time holding on to patients through the recovery because of all the other things that seep in. Not getting to those underlying drivers of addiction, not having the life skills going forward. We lose people and they go back out. So it's not just about the medication. Medication is simply a tool to quell cravings, craving drive relapse. If we can hold the cravings at bay, then we got a chance at treating the underlying drivers of addiction and helping you with the tools that you'll need to maintain your recovery long term.